Hello friends, welcome to Beyond Diagnosis, a new podcast supported by Kids Hospital Bhubaneswar and Dr. Kanungo's Diabetes Center. I am Dr. Alok Kanungo. In this series, I'll be talking to the best minds in medical science of the country. During the conversations, we'll dive deep into the arrays of different illnesses, their therapeutic approach, and lifestyle modifications. This is aimed at patients, their family members, general intellectuals, junior doctors, medical students, and those who are interested on science. We are lucky to have Professor Bidyut Das, the most noted name in the field of immunology and rheumatology in this country. He is the ex-professor of medicine, SCB Medical College, and presently head of immunology and rheumatology section of the medical college. He has mentored many postgraduate students during their research and thesis, and now he is mentoring the postdoc students because he has created the Department of Immunology and Rheumatology at SCB Medical College. He is the first founder of this subject. The more important aspect is being a top-class scientist. He does immense deep research into the field, but he's so popular among the mass because to meet him, people wait for days, months, and the long queue starts at 4 a.m. in the morning, and he never refuses a single patient and doesn't do private practice, never charges a single pie. That has made him a god figure in the state and the country. Welcome, Dr. Das, to our first podcast.
Thank you.
None other than you would have been this. We would have been happy for that.
First of all, I'm very thankful for inviting me for the first podcast. And you feel jittery when you are the first man, like an opening batsman in cricket. But it's a very interesting concept, what you have started doing. Hopefully, it'll impress people who are interested in specific aspects of the disease.
Mentioning cricket, if things would have been in the different direction, you could have been representing India in cricket because you are representing state and your coach told, don't leave this line. And you decided to come to medicine. And here also, you were batting sixers and all those things. So that is very good. Your subject is little different and little difficult also, or even for doctors. When it comes to immunology, people think first thought of HIV, then thought of COVID, but they are virus-induced immunity and other things. What is in fact rheumatology, study of rheumatology, and how does body immune system work?
Very interesting. Before I go into the core of the subject, let me tell you, when I first started immunology rheumatology in 1996, very few people understood the subject. And even today in the country, we have very few rheumatologists and not many students also understand the subject. Why? Because it's not taught. It was not taught to us. Right through my MBBS or my MD degree, we were not taught immunology. That's why there's a lacuna in the curriculum. It has been more or less now corrected last decade after I started the department. Now more and more people, more and more students know what is this subject about and what diseases it deals with. Otherwise, people didn't know that there is a department and there are specific diseases where you should go. Now, in simple terms, let me put it, rheumatology is a subspecialty of medicine. You have to be very strong in medicine before you can think about doing rheumatology, which deals with lots of things, musculoskeletal disorders, which affect the joints, the muscles, the bones, and inflammatory connective tissue disorders, which is part of immunology. And this department covers all the branches, means all the organs of the body. We say rheumatology does not spare any organ. Unlike conventional subspecialties like cardiology deals with heart, and nephrology deals with the kidney, endocrinology deals with the endocrine system, here it is all systems, because immunological problems affect all systems. And they are chronic disorders, they are controllable, not curable. So the numbers have been increasing over the years. So this is what people should understand, that some of these patients may be going to different specialties. Ultimately, they are referred back to us when they know that there might be an immunological angle to disease. So this is very important to understand.
So, how does the body's immune system really works for our common people?
Most people are not aware that immunological system is like an organ. You have a brain, you have a heart, you have a lungs, everybody understands that. But when we say immunology is a system, very few people understand that. Now, immunology takes the help of a system which includes two parts. One is called an innate immune system, another one is called an adaptive immune system. What's the purpose of the immune system in our body? It is to protect us. We have evolved and we have survived against infections and other predators because our immune system recognizes them as foreign and destroys them. So it has the capacity to identify what is foreign and what is self. And that is how, like, it protects us you against all kinds of infection. We are surrounded, all kinds of environmental toxins and cancer cells. When it fails, you'll get infection. When it fails, you'll get malignancy. Now, it uses these two systems, these two parts called innate. Innate means it has been present for millennia. All living beings have this innate system, which includes the vertebrates and the non-vertebrates as well. And it has evolved. Now, they are the first line of defense. The moment you get attacked, they will counterattack. And when they fail, you go to the adaptive immune system, which adapts to the changing needs. Like for in corona, it has never seen, the body had never seen, but in course of time, it adapted. And what system do they use? There are cells will they use. The innate immune system has very common cells like the granulocyte, the neutrophils, macrophages, dendritic cells. And the adaptive immune system uses lymphocytes. And the lymphocyte produces antibodies. Besides, there are chemicals like chemokines and cytokines which assist them. So they function together. They are linked up. The innate and adaptive immune system are linked. They have to function together. One cannot function without the help of the other. And therefore, it is extremely necessary to understand the immune system as such, because if it fails, we are finished. We will not survive.
That means, like in a state, if police department is not working, the thieves will take upper hand.
Yeah, that's an analogy. That's exactly the description, that in a system where the protector fails, then you're going to be condemned.
People suffer from many diseases, and because their immune system is compromised. When it happens, what compromises our immune system?
Yeah, as I told you, the immune system has two broad components, the innate and the adaptive immune system, and either of them can fail. And it can fail due to various reasons. Number one, the genetic component. Genetically, you are deficient in multiple components of the immune system. So you will not be able to prevent infection if they are not functioning well. So they're called primary immunodeficiency syndromes, PIDs. There's a whole chapter on that. Here, recurrent infection occurs in children, and you have to suspect infection when somebody in childhood gets recurrent infection, that he has got a genetic problem. The other one is acquired. For instance, you get infection. Commonest is HIV. HIV knocks out your T lymphocytes, and then you are unable to mount an attack on the infection that you have. Chronic diseases like chronic liver disease, like diabetes, chronic kidney disease, they all can downregulate your immune system. So immune suppression can occur because of use of medications and chemicals, as we use in cancer, like radiation therapy, chemotherapies. And in autoimmune diseases, we use immunosuppressants like steroids, which can downregulate the immune system. Besides, recently people are taking interest in finding out the link between the immune system and lifestyle. We know lifestyle diseases. We also know lifestyles are multiple things like stress, like amount of sleep you get, exercise. They all help in keeping your immune system fit. So if there is a problem with lifestyle, then you can suffer from immunological
This
disorders.
is a very big problem now. People are no more following that schedule of eating time. They are not going for exercise. They are feeling lazy, eating whatever they like, and that is possibly affecting their down regulation of their immune system.
We were aware, our forefathers understood that the importance of taking proper food, rest, and exercise. We lost it with modern day technologies and all kinds of contraptions that we use. We hardly do much exercise. We hardly do much. We are not very concerned about the kind of food we eat and rest we take. It's a very bad thing to happen.
It is a global problem
It's a
now.
global problem.
Dr. Das, you told about the suppression of immune system, but sometimes the immune system becomes out of control. Upregulation is
Yeah,
there.
that's the flip side.
Ah,
The major side is control. The body needs immune system to control us, and there are checks and balances. The multiple checks and balances, central checks and the peripheral checks. Sometimes this fails, what is called loss of tolerance. The immune system just fails because of multiple factors, and then here it becomes hyperactive. When the check is not there to control it, it becomes hyperactive, and that results in autoimmune disorders, where the system is now attacking your self, tissue, organs, without knowing that they are not the foreign elements that you have, because it cannot see that. So that hyperimmunity, or what is called autoimmunity, is the cause for so many diseases that we deal with in our day-to-day practice.
we see in diabetes, type 1 diabetes particularly, which is an autoimmune disorder, the antibodies GAD, IA2, zinc transporter antibody, they all work and they damage the beta cells. Our viewers would like to know what is antigen, what is antibody. This is a very important concept.
Antigen is a part of a molecule which is recognized as foreign, or which is recognized as self by the immune system, and they can recognize these as antigen provided they are presented in a particular context called HLA. We have an HLA system. Only when that is presented, then only the cells will recognize it as self or foreign. So when when the body recognizes it as foreign, and we call it a pathogen, which has an antigen that needs to be eliminated. So there is a whole cascade of triggers. The innate immune system will recognize it. It will present it to the adaptive immune system. The B cells and the T cells will function, and they will try to eliminate it by producing antibodies. So this is the method by which it happens. But here in type 1 diabetes or other autoimmune disease, they are called new antigens which are appearing foreign. The body has failed to recognize them as self. And this can occur because of genetic factors and environmental factors. Each disease has its own genetic components and environmental components. Roughly, it is said 30% is genetic and 70% is environmental.
Like a sentry or a guard is guarding the gate, and the boss is coming from a distance in darkness. If he doesn't recognize and ask him to stop, but he doesn't stop, he fires at his own boss.
Exactly.
That is the autoimmunity.
Exactly. It is blind to the fact that it is self, it is your own, or it is somebody else. So he will take drastic actions, and that drastic action is taken at the spot of the moment, despite checks and balances, and the consequences.
Consequence. That is it. How many? Which diseases are in fact autoimmune diseases?
You'll be surprised. People, we were all the time thinking about HIV as one of the immune system disease, and autoimmune disease means we're thinking about arthritis. Now, there are over 100 autoimmune diseases, and you can start from your skin to your eyes to your heart to lungs, anything, all systems.
The white patches,
Vitiligos.
vitiligos.
And, so you can have more than 100 diseases. In terms of arthritis, we commonly discuss about rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis. And in terms of connective tissues, we think about lupus, which is very, very common among young
You are
people.
doing a lot of work on lupus.
I have focused on lupus the last 10 to 15 years because it affects young women and it can damage the entire family. If a woman of the family is affected, imagine what happens to that family. So, and it's a very difficult disease to treat.
But still people have some hope. You are giving solution to any lupus patient.
Previously, the life expectancy was very short when you did not have much medications. Now, life expectancy increased to almost 20 years.
Oh.
90% people can survive 20 years if they are properly guided and treated.
Those patients can become pregnant, ladies?
Oh, yes, they do become pregnant. We have patients who have come pregnant. Initially, they used to have lots of abortions. We have identified the cause for that, treated them, and there's a guideline how to go pre-conception and during conception and post-conception. So we follow the guideline, and they can easily deliver a baby, healthy baby, without much problem, provided they follow the monitoring system that we give them.
Mm-hmm. We discussed how much genetic and how much is the environment in this role. Environment, would like to know a little more from you, that how diet, gut microbiota, and inflammation impact rheumatology.
Environmental actually plays a very big role in a susceptible individual. Somebody who's genetically susceptible, only when there's a trigger, so an interplay between genetics and environment, which leads to dysregulation of the immune system, that leads to autoimmunity. Now, environmental factors could be many. Most of the time, we know there are many diseases which are triggered by viruses like cytomegalovirus, Epstein-Barr virus, they're known to trigger. And chemicals, pesticides, we know, they can also cause. And so these environmental factors have to be kept in mind whenever we deal with an autoimmune disease. What could be the link? And rightly asked is a very interesting question about the gut and the gut microbiome. Recently, it has been seen that the gut microbiome, which contains trillions of bacteria, which are quite be positive and negative, means which are protective and sometimes they can be pathogenic, actually plays a very big role in modulating the immune system. They're supposed to be masters. These gut bacteria, if they are not, they are changed, but it's called dysbiosis, and you get more of bad bacteria in your system, then you are likely to suffer from hyperactivity of the immune system and autoimmunity. So, how do they help? Give a good bacteria that produce a certain substance called short chain fatty acids, and these short chain fatty acids are important because they maintain the lining of the gut, and the gut do not become leaky. If the gut becomes leaky, then all the toxins get inside the system, and they induce the immune system to produce more and more cytokines and other chemicals to make the system hyperactive. The other thing the gut does, it trains the immune system. Mind you, the gut is the biggest immune organ of the body. 70 to 80% of the immune cells are present in the gut. 70 to 80%. So when you take food, you take all kinds of things, antigens, which are foreign, and it is trained, the gut microbiome trains these immune cells to recognize what is good and what is bad. So the immune system
is a very important function.
Very, very important. There is a cell called T regulatory cells, which are produced in the gut by or induced by the gut bacteria. So the the microbiome is so important, and it is an important aspect. For instance, diet. You know, diet actually influences your gut microbiome. There are inflammatory diets, like you take processed sugar. A lot of us take processed sugar. We take ultra processed food, like what we take by buying from outside, and trans fat, bad fat. They are inflammatory. They don't really help the bacteria, good bacteria, to grow. So if you take that kind of food all the time, which the new generation, the Gen Z or the millennials are taking recently, they don't understand what happens to their gut microbiome.
They pick up some food from the deep freezer, which was prepared 6 months back.
They're bad.
Bad. They're bad.
And the good diet, the good stuff, what you told people talk about Mediterranean diet. What is that? Actually, it is mostly based on the high fiber diet. It is true for diabetes, true for most of the metabolic disorders. A high fiber diet, especially if you take good amount of vegetables, good amount of fruits, legumes, very, very important. Omega-3 fatty acids, especially fish containing omega-3 fatty acids, very important. And Avoid food like your alcohol and stuff that causes damage to your gut lining. And so, if you take good food, you'll have good bacteria. So, microbiome is very important. And inflammation is obviously sustained inflammation leads to inflammation leads to autoimmunity, and autoimmunity causes tissue damage and leads to.
So people should change their lifestyle and should select their food. Homemade food is always better. Always better.
Always.
More fibers, more fruits, fresh food is always preferred to stored food.
Avoid ultra processed food. Avoid red meat. Avoid stuff like high fat diets, like bad fats, trans fat. They are bad. You shouldn't take them. And therefore, you can take lean meat, chicken, dairy. They're all allowed. If somebody is having a gluten problem, then he should avoid gluten. So diet has a very important role.
So nutritionists must help people to choose, to select their food also.
I think immunologist and dietitian must work together.
Must work
in
together.
In dealing with the patient.
Yes. People think of your department only when they have joint pain or something. So how do you think rheumatology is now? You have already explained there are so many types of rheumatic problems, but what is present and what is future of rheumatology?
Let me tell you, rheumatology has grown in leaps and bounds. Previously, we had two different departments. It would be a department of immunology and department of rheumatology. Now people realize, no, they are all together. We are actually dealing with the same disease under different names. So now the department is called Clinical Immunology and Rheumatology. Rheumatology, people thought it was mostly joint disease, and immunology was connective tissue disease like lupus, Sjogren's, dermatomyositis. All these are inflammatory bowel disease. There are lots of in autoimmune disease. Arthritis meant we knew rheumatoid arthritis, psoriatic arthritis, ankle spondylitis, gout, and of course osteoarthritis, which is one of the biggest in the country. All over the world, osteoarthritis, although they're not classically inflammatory, they're mostly degenerative. But that's a major issue that people face. And we get lots and lots of patients involving joints, because the first manifestation of most of these disorders is arthritis. Just like fever is a presenting feature of many diseases in medicine, joint pain, joint arthritis is the first manifestation of most of the immunological and rheumatology. Therefore, they come first to us with joint pain.
And you select them, test them, diagnose them, and give them the right direction.
We make it very clear. They have come from different pathways. Like they've gone to an RV, they've gone to homeopath, they go to naturopath, they go to multiple people before they have come, have been referred, because they've not been helped by what they've done. Because this is a system. It's a very organized scientific system. And therefore, they come back to us from different departments. Because different departments receive autoimmune disease.
The commonest manifestation in the prescription is osteoarthritis. Do you find sometimes it is a wrong diagnosis?
Every disease has a classification criteria. We have certain diseases, most of immunological diseases are based on classification criteria. We use not diagnostic criteria. You have to take a history, examine, and then do some basic tests. Osteoarthritis is a loose term. I mean, there are classical features. If you see the patient, you can know. Do simple tests, examine the patient, do a simple X-ray, you know it's osteoarthritis. If it is inflammatory, then you do basic tests for inflammation, like what we do is CRP, ESR. They are called inflammatory parameters, and they are raised. That means you have some other disease. So you have to. So as I told you, we have two sets of arthritis categorized as inflammatory and non-inflammatory. Inflammatory is very categorical, as I told you, rheumatoid, spondyloarthritis, psoriatic arthritis. These arthritis progresses to secondary osteoarthritis. They damage the joints, as well as they cause secondary osteoarthritic changes. When they progress to stage 4, when the daily life becomes a very difficult issue, we have definitely asked them to do a knee or a hip replacement, which is done. But we don't go quickly and say, okay, you need a replacement, unless we feel we have a very clear-cut guideline. We feel if the patient is really bad, is unable to move, and it is stage 4, we ask them for replacement.
Before stage 4 or before replacement is a choice, only choice, do you recommend any exercise to these painful joint problems?
Exercise is almost an integral part of treatment in rheumatology. integral part. I'm highlighting that. Why? Because nobody does more any exercise. Everybody thinks that medicine or injections will cure them. It doesn't happen. Exercise is very, very beneficial, both for inflammatory as well as for non-inflammatory. Why? Number one, it helps in lubricating your cartilage, helps in regrouping or making it healthier. Number two, your joint, your muscles which are surrounding the joint, they become healthy, they become strong, they offload the pressure, and the pain reduces. Pain reduction is and preventing progression of the disease, mobility and deformity is helped by exercise. And there are exercise protocols for each joint. And if you do it every day, 30 minutes or 20 minutes, you will gain a lot. Most of these patients gain a lot, especially osteoarthritis. It's a disease where do not have many medicines. Do not have many medicines. It is simply lots of exercise and lifestyle changes, reduction of weight. We know obesity is one of the important causes of osteoarthritis. Sedentary practices is a cause of osteoarthritis. If you change those habits, do exercise, stick to exercise. Don't believe in all these lots of injections and lots of tablets and other things. Till now, recommendations are that a good exercise is very important in osteo.
Are there any tests that you would recommend to our medical students, junior doctors, to diagnose rheumatological disorders? And what is the general approach to such problems?
I'm very clear about diagnosis of a problem. Number one, good history taking and good examination solves 95% of the patient. This is called what is called pattern recognition in rheumatology. The particular pattern you see, you know this is the disease. So diagnosis is almost 95% based on history and physical examination. To support it, you need around 5% of very specific tests. For instance, you think it is rheumatoid, 95% clinically. You do rheumatoid factor and anti-CCP, something like that. You know it is lupus based on skin rash, based on oral ulcers, alopecia, other things, fever. You do a ANA, very important. You do a dsDNA, you do an ANA profile or C3C4. They can give you the diagnosis. So if you have got spondyloarthritis, stiff spine in a young man, you do an X-ray, you find bilateral sacroiliitis, do an HLA-B27 if necessary. Diagnosis is made. And basic tests you have to do, because you have to do a simple routine blood examination, urine examination, liver kidney test, because when you're giving medications, you should know the side effects.
Exactly.
For specific diagnosis, you have specific tests. And for routine follow-up monitoring, you have to do all routine tests. So the approach is very simple. Take a good history, do a good examination. 95% of cases you can diagnose. And rest, 5% you add both specific tests and non-specific tests. Based on the disease diagnosis, provisional and then final, the treatment is done. If somebody needs steroid, you give steroid. If somebody needs non-steroidal anti-inflammatory, give them non-inflammatory. But mostly we are depending now on DMARDs, disease-modifying agents, which is the latest. And now better drugs are coming out called biologics and small molecules, which are in flavor today. Targeted therapies. So the armamentarium of the molecules, the drugs have improved a lot in the last 2 decades. Now we have more drugs to play with, and therefore, but they have to be rational. I insist on rationality of prescription, not in easy availability or in deciding that we should give this. We have to follow a protocol.
There is a common belief that if you give steroid, patient will be all right quickly, and in fact that suppresses the immune system.
Yeah, it does. But basically, steroid is given for very specific reasons. For instance, the rheumatoid, we give flare. Patient has come in flare, very severe disease. We give low dose, 10 milligrams, and we taper it out in 3 months. We don't continue. If there is lupus, even lupus patients who are life-threatening, we have to give them high-dose steroids to suppress the immunity, and then we taper it off, less than 5 milligrams by 6 months to 1 year. So every disease, autoimmune disease, which requires steroid, has to be given at a particular dose as recommended, and they have to be tapered as quickly as possible so that the side effects are minimized.
Thyroid has also some autoimmune varieties.
Yeah, it has, for instance, Graves' disease, thyroiditis, Hashimoto's thyroiditis. Steroid doesn't have any role to play. Most of them are.
So they are also autoimmune.
Yeah, they are also autoimmune.
So Dr. Das, it was a nice discussion. our even doctors. As a doctor like me, we have learned many things from you today. At the end, what will be your message to young doctors and general public in different age groups? This podcast must be heard by people, young people and elderly people also. What is your general advice to people at a whole?
For students, I'm very attached to students because I see the future of this country depends on students. Medical students must know that to become a doctor, you have to spend time in the clinics and see patients. The more number of patients you see, the more experience you gain, not by just reading books. Textbook knowledge is textbook knowledge. Skill comes only from bedside teaching. We learn through bedside. And you have to do a proper examination. Again, I insist, clinical examination, history taking is vital in our field, in all fields. I think in all, because I've done lots of medicine, I know. A diagnosis you can almost reach by doing a good examination. So you be very specific on this aspect of your training. Other thing is be appropriate in asking for investigation. Don't ask everybody for MRI. I see hundreds of MRI where a simple X-ray would have helped. MRI was not necessary. So everybody is asking for MRIs and CT scans. 3, rational treatment. These are 3 things for you. For general public, don't be very carried away by high-sounding tests and high-sounding drugs, and they are always will be discussed. And be aware of the disease, and don't depend too much on Google and chat GPTs and other things which people follow AI, and then they fall in trouble because chat GPT and AI cannot solve your problem. Go to a proper person who can direct you in the right direction. That is for the general public. And lifestyle modification is mandatory for all these diseases, for all the diseases. Type of diet you take, the type of exercise you do, reduction of stress, do meditation, do pranayam, do all these. I believe in all that. The Tai Chi is excellent. I know that's one of the methods by which you can reduce your stress. And yoga is excellent also. They are all interconnected. They are scientific. It's scientifically proved how it controls the immune system. It's not that somebody says you do yoga, you'll be okay. No, it's scientifically proved. So lifestyle, take proper food, maintain proper sleep habits, take proper medications if you are taking medications, and consult your doctor regularly when you have a problem.
Dear friends, you learnt and listened to an expert who has lived his life with people with pain, and as a good astute clinician, he helps them like the best doctors are available in the world. So thank you very much. We'll be coming back to you in our next episode. Thank you, Professor Das.
Thank you
for spending so much of time with us, and people will be definitely benefited by this podcast.
It was a pleasure interacting
Thank you.
with you. Thank you.